As the summer heats up, many of us are heading to beaches, lakes, pools, all to cool off. We want to make sure that you have fun without any of the ill effects that come with all of that. So with us today is Dr. Philip Lamptey, Medical Director of Cone Health Virtual and Urgent Care. He's here to share recommendations on preventing water-related illnesses and as well what to do if you are exposed. Okay, so Dr. Lamptey, let's just kind of start with pools because that is one of the most common places for folks to cool off around here. If someone has a cut or an open wound, can they get into the pool?
So it depends on the type of wounds. For people who have surgical wounds, who have piercings, those who have new piercings, and those who have infected or draining wounds, typically, or bleeding wounds, typically we say that stay out of the pool. For those with minor cuts and abrasions, if they will enter the pool, they should make sure that they have a waterproof wound dressing over the area before they get in the pool.
Gotcha. Okay. This is very common. You know, you go to the pool, you're playing around, you accidentally swallow a whole bunch of pool water. How concerning is it? At what point is it concerning, and what should you do about it?
Generally, we say that pool water, you should not swallow pool water. And if you do, I would say you should not panic. You should look out for symptoms like nausea, vomiting, abdominal pain, and diarrhea. If you have any of those things after you've been to the pool, then it's time to reach out to a provider or a health professional for advice. And with Cone Health, you could do that virtually through the comfort of your home, or if you live near to any of our urgent care sites, then you could come through and then we'll evaluate you and give you the necessary medical advice that you need.
I guess we're worried about chemicals and maybe other things that could be lurking in the pool.
Yeah, so you're worried about chemicals, and then so you're worried about infections also that could emanate from you drinking pool water.
Gotcha. Okay. All right. So let's talk about splash pads and those kinds of things. Kids, adults and kids like running through all of them and that kind of stuff. What are some of the do's or don'ts to avoid spreading or being exposed to germs in that kind of water?
I'll say that splash pads and water fountains are always fun for adults and kids. You should always make sure that you have the right footwear so that you don't slip and fall. Also, if you have any medical condition, you're not feeling well, or you have diarrhea, that is not the time to get into splash pools because you might spread whatever infection that you have to other people enjoying the splash pools and water fountains as well. And those are mainly the things that you should be mindful of. And also stepping on the faucets that the water comes out from or shoots out from is also a thing that we don't encourage because it also contributes to spreading of infections if there is any.
All right. Of course, like kids and stuff, they like to put their hands over them or their feet over them, that kind of thing. And you're saying we should make sure that we tell the kids, hey, let's not do that.
That's right.
Okay. All right. Let's talk about inflatable or plastic kiddie pools that folks use at home. What do we need to keep in mind there?
Yeah, this is one that we use a lot for birthday parties or hanging out on the weekend with other kids. We should always remember that drowning is still a concern, especially for kids. So adults should be vigilant because drowning takes just a few seconds and kids can drown in silence. So that's one thing that adults should always be vigilant when there are kids involved in that. The second thing also is that after you finish using your inflatable or plastic kid pools, you should always clean it. And that helps prevent water-related illnesses that we may encounter using these inflatable devices.
Okay. All right. Let's kind of switch to like bigger bodies of water, like oceans, lakes, that kind of thing. So often, you know, you would hear people say, well, I have a little minor cut, but the salt water is going to cure it. So let's kind of talk about that. What are the do's and don'ts when it talks about like having a cut or something like that and then going into a beach or lake water?
I think with natural water bodies, if you have any abrasions or cuts, or if you have any of the things that we talked previously, a surgical wound, a new piercing, bleeding or infected wounds, it's best to avoid it because it's not like a pool where we have is chlorinated to take care of bacteria and things like that. So you're more likely to have infection if you don't have one when you get into natural body water or a natural water body um, with open wounds and cuts and other skin conditions.
Gotcha. Okay. All right. We are going to continue on this discussion about water-related illnesses, what you need to know. We're going to be coming back for our next segment in just a few moments.